buildings impact our health, mental well-being, and how we physically feel in the space. Health can be influenced at three levels, right? So there are laborers and on-site workers when the building is getting constructed. Then comes the time when the building is in use, it's in operation. And the people that get impacted are the residents and the users. Third level would be like neighborhoods. How do they get impacted um, by the construction that happens around us, right? The built environment contributes about 39% of global carbon emissions.
Thanks a lot, Aakrity, for joining us on this podcast for Health Spark and seeing your work around sustainability and ESG. My first question would be very obvious, and it's also something which common people would want to understand. That, I mean, for us, construction that way, building designs has, people seem to think that it has nothing to do with either health or environment. And looking
Mhm.
at the scenario right now, how erratic the weather has become, we are facing heat waves, then we have droughts, we have floods. Can you just explain the linkages between the two?
Okay, first of all, I'm an architect, trained architect, and now I'm an ESG and sustainability consultant across continents. And having worked in different contexts, different project typologies, different kind of problems, like I for sure know that like buildings impact our health, mental well-being, both, and how we physically feel in the space. So the way I think about it, like in the construction sector, health can be influenced at three levels, right? So there are laborers and on-site workers. When the building is getting constructed, they have exposure to dust, heat, sometimes unsafe working conditions, as we see in the global south usually. Then comes the time when the building is in use, it's in operation. And the people that get impacted are the residents and the users. So the way we can think about it is the building well ventilated? What are the kind of materials that are being used? Are they toxic or are they health positive? Do they cause heat stress? The materials themselves, do they conduct heat? Do they radiate heat? Do they deflect heat? So there are many ways well-being can be seen when the building is in use. And I guess the third level would be like neighborhoods. How do they get impacted um, by the construction that happens around us, right? Do we have a lot of noise? Do we have displacement of communities? Is the building taking up the space of green buffers that a society needs to function well? So all of these things in buildings, in the way we build in the construction sector, affect people, the ecosystem around it, around the physical space of the building, and honestly, the building itself, like how long it lasts, what is its life like.
And does it also have impact? So, suppose the building is poorly ventilated, there's no
Mhm.
sunlight, there's no proper air, and then there's this constant noise pollution. Does it also affect your mental well-being?
Absolutely. I mean, let's just talk about how you and I might feel when we walk through a park in fresh air, where we're feeling a little bit of a breeze on our bodies. It immediately makes us feel better. So it's not just about like whether I have good indoor air quality, but do I also, indoor air quality also relies on um, a little bit of airspeed. Do I feel like it's a stale environment when there is no cross ventilation and when I can't feel a breeze? Absolutely. um, when there's a lot of humidity inside a house, I feel stifled, right? It's I think we can all just really imagine how we personally feel in these spaces, and that's how I now try to um, design as well, like with that lens in mind. Like, what are these smaller design aspects of a building that help me just feel better on a daily basis? And I think that it's also proven that that improves like productivity in offices, etc., in residential spaces. And it also depends on like who we are catering to, right? Like we might be catering to an elderly group, and they might benefit from a lot of walkability, from a lot of light, air, considering that immune systems are already compromised at that age, or we might not have um, as much capacity to move. But when we have these environmental factors, it kind of also pushes us to do more and to get out. Um, so I would say absolutely, like it support, like a building can really support mental well-being in the way it's designed.
Akriti, you've raised some very important points, and I'll come back to them later. But you've studied in Harvard. You have yeah, you've been there in US. I'm sure. Can you just tell us how did your perspective evolve around, say, architecture, ESG, sustainability, and how does India compare to these countries when we see our constructions or our cities through that lens?
Okay. So Pranjal, I before going to Harvard, I came from a school of like natural building, building with passive house techniques. So I've been an architect in India and across Southeast Asia, done some research on materials as well, and like low cost, low carbon alternatives. And The reason for me to go to Harvard was because I also wanted to understand how uh, we're now building at scale, and where does sustainability and health come in the picture when we build at scale, because we're also going to see um, I mean, most buildings that will house urban populations in the coming years have not been built yet. And we're going to see a lot of growth in tier 2 and tier 3 cities. So it's important to now understand how to build at scale, which is why I went there. Um, I think there are many differences, and I can't say one is better than the other. I think what studying in the US at Harvard, studying the Masters in Design program for energy and environment, what it did for me was like provide a vocabulary and a toolkit to understand the impact of design. So, like while I was building sustainably for over 8 years before then, and working with communities, I didn't quite have a way of quantifying that impact. And also understanding the built environment's life, like full life cycle impact. So from construction to operation to what happens to the building at the end of its life, right? The built environment contributes about 39% of global carbon emissions. We've been talking a lot about carbon emissions, so I'm bringing that fact out. And 28% of it is from its operations, so heating, cooling, etc. But the rest also comes from its materials. So materials have embodied energy in them, where they're transported from, how they are mined, how they are extracted, to how they're processed. All of that energy is basically stored in those materials. So it is with like this quantifiable understanding that I can now conceptualize the design and impact from the get-go, and it allows me to guide clients better because they are bound by regulation. They have to take the risks on their investments, and with the climate changing so much, I as a designer need to be better informed so I can like guide my clients uh, better.
So, when we were talking about our first question, you gave us the three levels at which it is impacting people. And correct me if I'm wrong, but I see the most vulnerable population is the population which is working on the ground. Your working
Right.
class, your labor, your daily wages. Uh, my next follow-up question would be that uh, in cities, how do we ensure that they also have a habitat where uh, these things can be followed? I mean,
Mhm.
is it affordable? Is it not affordable? What role should
Mm.
a government play in ensuring that they also have a better housing facility?
Right. Well, incidentally, that is one of the projects I worked on early in my career. We were creating portable housing and using construction materials that were like scaffolding that goes to waste essentially. Um, the idea being that um, the communities that basically build our buildings, they are usually migrant communities. They are at high risk of eviction. They live in less than ideal conditions, of course. But they also build their shelters with salvaged materials and have to replace them every
Once
quarter
the
sometimes.
construction cycle gets over.
Yeah. But actually, no, but even seasonally, right? Like a
Yeah.
construction cycle might go on for like, let's say 2 years, but um, I might see floods, or I might see tornadoes, etc. But I will have to replace the materials because they're not pakka houses. So, so we were building a kind of a portable housing scheme where we provide the structure for the house, and we were kind of what the idea being that the skin of the house can still be something that the migrants themselves procure. Sometimes they use tarps, sometimes they use even saris, for example. But if we can provide them a structure that they don't have to replace every single season, then they're better off. They can save up for other expenses like healthcare. And what we were also taking care of was like, okay, can we level the house even on an uneven terrain? Can we raise it up because that avoids rodents, that avoids flooding? Can we provide one of those, industrial fans in the roof so that even if cooking needs to take place inside the house, um, it can it can be done without causing respiratory illnesses. So I can't say that that project was perfect. I'm sure there are many ways of doing this better. But if there can be government schemes where we can provide this structure and like parts can be replaced as and when needed, these kind of government schemes can really help a community thrive.
Thank you so much, Akriti, for giving us time to speak to you and for your valuable insights. And I would urge all our viewers to follow your work. And if you could tell where they can see your work, that would be great.
Sure. Right now, mostly on LinkedIn, I do post sometimes. So that's just my name, Aakrity Madhan. You'll find me. But I do plan to write a little more uh, on my website. I'll post that on LinkedIn, I'm sure. But I'll write a little more about how architects can design better. And yeah, that would be it. And thank you so much, Pranjal. I'm glad I could get some thoughts out on this. And thank you for making this subject a part of your series, because it's a very important topic that we haven't spoken about enough. So
Thank you so much, Akriti. Thank you so much.
thank you, Pranjal.